Okay, this is nutritional counseling for Shantae. So, Shantae, I want to let you know that since the last time you were here, I've analyzed your food diary that you gave me, along with some additional information that we've gathered since your last visit. And I'd like to continue the discussion with you regarding your nutrition and oral health um, and how you can prevent future cavities and gum disease. Would that be okay with you?
Sounds good.
Okay. So, are you aware that nutrition and eating are directly related to your dental and oral health, and that disease and other oral issues can affect your overall health?
Not really. I mean, I know, yeah, like plaque builds up or whatnot from what you eat, but that's about it.
Okay. All right. Well, through some of the information that we gathered, I'm going to show you how that directly relates to your oral health and how it can affect you. Um, a couple of the things that we looked at was your medical history. You don't have any systemic conditions, meaning you don't have any diabetes or heart disease at this time, which is great. Your blood pressure looks really good, but we'll continue to go ahead and monitor those things. You do take a few medications that can affect things like dry mouth, that reduces your saliva, that can affect things like cavities. And so we'll talk a little more about that. We have done a xerostomia counseling, the reduction of saliva with you already. So we'll just talk a little more about how that's going to affect the increase in cavities. But we'll continue to monitor those things, with your care. Another tool, though, that we use is this sheet, which is a caries risk factor. And what we do is we check off different things and based on certain criteria. And the scores are based on low, medium, and high. And these show us what we've checked off for you as far as how many are related to nutrition. So you've got several different areas based on visible plaque that's on your teeth. That one's checked off. You've had a cavity in the past 12 months. You've also had visible cavities on your x-rays. You've also got a missing tooth in the past due to a cavity. You've also have sugar consumption in your daily diet, frequent carbs in your daily diet, a high carb diet, and of course we talked again about the low salivary flow due to the medications that you take. So this puts you in a high risk for cavities. So this is all due to nutrition and diet, and we're going to talk more about that. Okay, so this is one of the assessments that we use. So, all right. Another thing that I've done was looked at your x-rays, and I also took some intraoral pictures of your teeth to help you see for yourself. So we've taken a look at these intraoral pictures. So you can actually see the fillings in your mouth and also some areas where some of the fillings are starting to break down due to what's called recurrent decay, which means cavities that are forming underneath the fillings you already have. So we'll talk more about those. So the way that a cavity occurs is, God bless you. So the way that a cavity occurs is our enamel is the hardest surface in our mouth, and so every time acid attacks that enamel surface, it starts to break down that mineral, that enamel. And you can see on here that one of the most common places for that to happen is in between the teeth. It's one of the hardest areas for us to clean. How are you with your flossing?
It's not my favorite thing to do.
Not an uncommon thing to hear. But the good thing is that you're using that power toothbrush, which is great because that is helping you to remove some of that plaque. And we'll talk more in your oral hygiene when we go through that, how to better use more techniques to just get a little bit better with removing that plaque. Um, but the flossing is going to help because that's going to help reduce the plaque in between the teeth, which is going to help reduce those cavities. But that's a really common area to see those cavities start to form. And once it breaks through that enamel and gets into the dentin, which is the softer part of the tooth, that's where the cavity is not reversible. And now,
Oh, is that like
yep,
it's breaking through the tooth?
it's
And that's
breaking
what.
through that enamel and getting down into the tooth. And so, yeah, so that's what we're trying to prevent. And obviously, you know, cost is always a big factor for a lot of people. Is that a factor for you in dentistry? I mean, is that a concern for you at all? Um,
Um, I guess maybe a little bit.
okay. Um, just because obviously, you know, if we can prevent you having to spend more money on doing dental care treatment as far as cavities, crowns, root canals, things like that, um, then, you know, if we can prevent those things, that'll save you more money and we can just focus on prevention. So that's one of the things that we want to look at. The other thing that I noticed is that pain was one of the factors when we were cleaning your teeth. Um, and so a lot of the pain that you have is due to the inflammation in your gums. So one of the reasons you have the inflammation is because of the plaque sitting on your teeth. So the better we are at removing the plaque, the more we can reduce that inflammation, and also that bleeding that comes along with the inflammation. And then we can prevent any disease in the bone, because we don't want to lose bone, because that's what's holding our teeth in. And then, so the pain was one of the things that I noticed might possibly be an obstacle for you. But have you noticed any other obstacles that you're having besides pain, as far as, you know, your dental care or your dental treatment? I mean, flossing, obviously.
I was
I know
gonna
you
say
said.
the flossing piece.
Do you have
Yeah.
issues with, you know, getting to dental appointments or?
Sometimes I used to have a regular dentist where I grew up, but then since I moved, I have not sought out a dentist in this area.
Okay, okay. So that's something we can talk more about and help you with that as well. Okay, so let's get back to the eating habits. So how do you feel about making any changes to your eating habits, as far as, you know, improving your overall health, based on those eating habits that you have? Are you open to that, or are you comfortable with the way you're eating now?
Probably a little bit of both.
Okay, okay,
It's hard. It's hard
yeah,
to make changes.
okay. Well, I went through and I looked at your 5-day food diary that you gave me, which I really appreciate you taking the time to do that because it's extremely helpful for both of us. And what I did is I made a couple of modifications to the diet that you have. And I've kept many of the things that you have in your food diet that you regularly eat and just added a few things and changed a few things. So that way you're still able to maintain the foods that you like, but just add or subtract a couple things or substitute a couple things. Okay. So that way you don't feel like you're making big, huge changes, but yet you're making good choices to help be more nutritious and help your oral health. Um, so one of the things is, what we've talked about so far is reducing sugars and carbohydrates. Okay, on that risk carry sheet. Um, and so one of the things that I noticed, you have a lot of sugars in your diet. One of them was sodas. So how do you feel about weaning off the sodas or reducing your sodas?
I think that's fairly doable.
Okay.
Yeah, as long as I don't have it at home, it's just not buying it or not having it on hand, then it's obviously a lot easier.
Okay.
And I feel more comfortable. I'm not so much craving it. I just know if it's in the house, then I'm going to drink it.
Okay.
Is it still recording?
Yeah. Okay. So, do you shop for the soda, or do you try to not do it? Or
I try not to.
Okay.
Typically, I usually just skip that aisle because I usually, unless like I'm looking to get it for something, I just generally kind of stay away from there.
So one of the recommendations is that you could still have a soda, but what we would recommend is that if you're going to have the soda, have it with your meal. Drink it all in that one sitting instead of sipping it all day long. And then maybe incorporate water with it. So, do you tend to drink a lot of water?
Mm-hmm.
Okay.
Usually, yeah.
And that's good because the water helps to reduce that. Because what happens is when you eat a sugar, it creates an acid attack on your teeth. So every time, and then like we talked about with this, every time you get that acid attack on the teeth, that's what's going to create those cavities to start breaking down the enamel and then create a cavity. So if you're sipping on a soda all day long, every time you take a sip, that creates the acid attack. Mm-hmm. So if you just drink the soda while you're eating the foods and then incorporate a water to help reduce the acid attack, that will help reduce that. Mm-hmm. What happens is every time we eat something or drink something, it changes our pH level in our mouth. Mm-hmm. So those pH levels are what we're trying to monitor. So what I've done is I actually made a list for you of some foods and what their different pH levels are. So you're able to incorporate this with your foods. When you're looking at your foods, you can actually take a look at this and see, oh, okay, this food is going to reduce my pH level in my mouth. Therefore, I need to incorporate something like a dairy or water or, maybe like a raw vegetable that will bring that pH back up in your mouth and reduce that acid attack. Okay.
So what number do you want to shoot for?
So 7 is neutral. Okay, so as the number reduces, the acid is going to get worse. Okay, the more acidic it's going to get. So things like raw vegetables help cleanse the plaque off our teeth. Nuts, real fibrous foods, those are great for helping to remove plaque from the teeth. So those are great things for snacks. And then always incorporating water every time you're eating or drinking something will help reduce the acid. The thing is you want to be careful because a lot of the waters tend to have sugars in them too. So do look at the labels on the waters because things like vitamin water have lots of sugar in them.
Right.
So you do want to, as much as you can, try to just use regular water, filtered water. Mm-hmm. And then carbohydrates. Now that's another thing. So you're really big on carbs, right?
Yeah.
Okay. And carbs are great, but the bad thing is that carbs stick to our teeth. We call these cariogenic. And what happens is those carbs eventually break down into sugars. So again, we fall into this problem of now we're getting an acid attack again. So if we're going to have carbs, that's okay. But if we can change the types of carbs that we're having. So do you like things like popcorn? Okay, popcorn's a great carb, okay, because it's a little more rough and crunchy. So again, great carb because it'll help, remove some of that plaque. It's a great snack. And it's not as likely to stick. Although It can get stuck in between our teeth,
Yes.
so we do need to floss better.
Right.
All right. The other thing is things like oatmeal. Again, more fiber.
Mhm.
So I don't know how you feel about oatmeal.
Mhm.
That's a great thing. And then also things like eggs.
Mhm.
Are you big on eggs at
Yeah.
all? Okay,
Yep.
so again, these are all things. So what I did is I basically made a 5-day food diary for you and incorporated many of the foods that you had in your 5-day diary. But then again, just added in some of those things we talked about, like the raw vegetables for snacks, popcorn, oatmeal, eggs, some of the things that you've acknowledged that you do like, and adding water into those things and reducing some of the sodas, but still allowing for the sodas, but just incorporating them with the meals.
Mhm.
And you can still have sweets, but just including the sweets with your meals.
Mhm.
Okay? Um, so, um, so what do you do to break some of the habits and choices in your nutrition? Like, what would you say? Like, you try to do?
When like grocery shopping, I guess I try to at least grab, one fruit, one veggie, at least.
Okay.
Depending, and with the money factor, I usually try to get what's on sale or if it's on sale.
Okay.
Um,
Great. And that's really really good. Again, adding in the fibers, and grains, those will help as well. So if you can,
Mm.
you know, start to add things like that, yogurt, dairy is also a really good thing to add in there. So cheese
Mm.
and dairy really is a helpful thing as well. Um, and then, like I said, anything that's real cleansing, which is your raw vegetables. So, um, I also put together, this is a website that is really great for helping you find healthy eating styles. This is called My Plate. And it just helps you determine meals and portions and different things. So I don't want this whole process to be overwhelming for you. And what I wanted to do was for you to be able to go at your own pace and work with your lifestyle, but at the same time help you reach your goals. So I want you to feel free to discuss what we talked about with your family and your doctor, and ask more questions about your general health concerns with your doctor too, and see if they have any suggestions as well. I'm not a nutrition counselor, but obviously any additional information that you can get from them is always helpful. I included our clinic's card and the number, so feel free to contact me or the staff with any questions or concerns about anything that we discussed today. I'm going to put some notes in your chart today about what we've discussed. And I'd like you to just, try to do a 5-day with this new uh, diary that I gave you and see how you feel about it. And then the next time that I see you, I'd like to know your feedback on it and how you feel. And if there's any additional changes that you've made. Um, and then we'll just continue to work as a team together on this. Continue to work with your power toothbrush, removing that plaque and work on that flossing. And we'll go from there. Do you have any other questions for me about the food or?
no, I don't think so. This is great. Thank you.
Yeah, absolutely. My pleasure. Thanks so much for coming back in today to go through all this with me.
Yeah.
All right. Well, have a great day.
Thanks.